We are in the midst of a pediatric mental health crisis, and bills like this are further marginalizing groups that are already at increased risk for poor mental health and physical outcomes.
New tonight, a discussion about the possible outcome of the so-called Don't Say Gay bill on our children's mental health. The controversial bill is quickly moving through the Florida legislature. It has not passed yet, but it's scheduled to go before the House Judiciary Committee tomorrow.
And as you might know, it's already started a lot of discussion. CBS 4's Karli Barnett joins us in the studio. And Karli, you spoke to a child psychologist on this topic.
Yes, Lauren, Elliott. Now, this bill has garnered not just local, but national attention. And those who support it say it's not a teacher's place to talk about these so-called social issues with children. But we spoke to a mental health expert who says this could have some pretty damaging consequences as written.
LGBTQ support organizations and some mental health experts are pushing back against what's called the Parental Rights and Education Bill, probably more widely known as the Don't Say Gay bill, as coined by those opposed.
We're giving a voice to a parent because they don't think that their child should know that we exist. That we are simply here on this earth.
Members of Safe Schools South Florida were in Tallahassee to speak with lawmakers and lobby against the legislation.
And sometimes kids at home don't have that direct communication. They don't have a support system.
The bill would ban discussion of sexual orientation or gender identity in elementary grade levels in a manner that is, quote, not age or developmentally appropriate. It would also give parents the right to sue schools they feel violate this. State Senator Dennis Baxley is one of the sponsors.
I'm particularly concerned about early intervention and shaping and social engineering their views about topics that are much more sophisticated than primary age children should be even struggling with.
Dr. Natasha Poulopoulos is a pediatric psychologist.
Children really begin to have an innate sense of their gender identity between ages 3 and 5. And then we see that gender consistency is formed by age 7.
She fears banning this language could further marginalize students already at risk for poor mental health outcomes.
And research has shown that LGBTQ plus youth who learn about LGBTQ plus issues at school actually show a 23% decrease in their suicide attempts. I'm strongly urging that this bill be eradicated, and instead we shift to a more affirming school environment for all students, and in that way we're protecting all youth.
Dr. Poulopoulos mentioned that it shouldn't be a partisan topic. She says the numbers really speak for themselves. The Trevor Project, that's a suicide prevention organization, found that more than 40% of youth who identify as LGBTQ+ considered suicide last year.
Karli, have the sponsors of this bill mentioned any specific event that happened in our schools to lead them to create such legislation?
Well, when I spoke to Senator Baxley, he says he has seen materials to address those topics in elementary schools. He said that was indirectly through some consultants. He says he believes they were trying to work on relationships with students. But he says, in his words, he feels that goes too far. Now, he couldn't specify which school districts or counties that was happening in Florida.
Karli, how specific is this bill? Does it include children who may have gay parents or maybe are questioning their own feelings about sexuality?
I asked Senator Baxley directly that about students with gay parents, for example. Can they reference that they spent time with their two fathers or their two mothers going to the park? And he says he understands that children are going to have conversations and they can't prevent that, but he says it's the teacher's job to keep it focused on the lesson plan and that it shouldn't distract from teaching what he calls those basic core skills.